Hello everyone, how you doing? Hope you're all very well wherever you are in the world. This is a mental health update video. First of all, let me start by apologising for the poor sound and quality. My flip camera that I usually film, which is HD, has decided to give up on me. So I'm having to use the very rubbish webcam on my laptop, so I apologise. Anyway, it's Friday. 2 days ago I had my appointment at the Autism Aspergers clinic at Reading University. It's an appointment that I've been waiting about 10 months for, so I was eager to go. I've discussed in previous mental health videos that my doctor at Newbury Hospital has basically suggested that my problems are a dissociative disorder born of anxiety and bad things that have happened in my past, and that I don't have autism or Asperger, or at least my problems aren't on the autism scale. But the doctor said that I should go to this appointment because they'll be able to actually discount a lot of things and maybe find some other problems. So basically I arrived, I cycled all the way there and all the way back, which was a journey of 30 miles. Which was wonderful because it made me feel fit and healthy. Anyway, I got there dead on time, about 10 o'clock, went straight into the interview. I was slightly nervous. I mean, obviously I have anxiety anyway, so I was anxious about it, but it was really perfectly fine. The first thing that happened was I spent about an hour in a room. No, sorry, I apologise. The first thing was I was introduced to a lady doctor and a male doctor. I was told that the lady doctor would speak to me on our own for about an hour, and the male doctor would leave the room, and this was because I was going to talk to him for about an hour and a half afterwards, but he needed to come to his own conclusions, so he didn't sit in on my discussions with the lady doctor. So he left the room so that he could learn nothing about me. He needed to know nothing about me until he spoke to me. So spoke to the lady doctor for about an hour. She basically just took me back to my very earliest memories of being a child. Took me all the way through my primary school, my secondary school, job history, relationship history, all this stuff. And despite the fact that I was quite anxious when I went in, she spoke to me in a very interesting way that made me feel very relaxed. I guess, if you are somebody who has autism or Asperger's, she has to be very relaxing because people often can get very uptight about answering questions and talking to people. So anyway, she spoke to me for about an hour. It was very interesting. I didn't feel like it was an interrogation or it wasn't like an interview, it was just a conversation. Then as soon as we'd finished, the gentleman came back into the room, and he then kind of did a different thing where he had like a form to fill in. It was like a scorecard. And he asked me all about my feelings and my thoughts and how I sort of communicate with other people. And then we did these exercises so he could see what my imagination was like. One of the exercises was we had a children's storybook, had no words in it, it was just pictures. And he opened the book and to the first set of pictures, and he began to create a story with his imagination from the pictures. He then told me to carry on turning the pages, looking at the pictures and carrying on a story. So I did that for several pages, then he would come in, carry the story on. So the two of us were creating this story from this picture book. And it was all about seeing how my imagination works. And we finished that. He asked me about the kind of things that I love to do, how I told him that I love to ride my bike and I love to ride up hills, and I told him, it was a wonderful feeling. He was asking me, explain the feelings to me, all this kind of stuff. Then we did another exercise where he had a bag of just kind of bits and pieces, junk that had been collected, little children's toys and blocks and playing cards and stuff like this. And he pulled 5 things out of his bag, and he then created a story from these 5 things that he pulled out. And then he told me to do the same. I pulled these 5 things out of the bag, and this was really difficult for me. I really struggled to come up with a story, and in the end I just sort of I couldn't do it, actually, which is really strange, because I do have this really vivid imagination. I mean, I'm very good at making up stories, but I just couldn't do it. And I think the reason I couldn't do it is because I was kind of felt like I was under pressure, because there were 2 people sitting there sort of waiting for me to come up with something, and I just sort of, anyway, I couldn't do it. He said that was perfectly fine. It wasn't, he wasn't asking me to do this as a sort of definite test. It was just to see how my mind works. So anyway, these 2 processes, they took about just over 2 hours. I went back into the common room, sat in a chair, had some water, took a break. 2 doctors came together and conferred and put their notes together. They called me back into their room, and they basically told me very good news. Well, I think it's good news. News that I probably already knew, that my problems are not based on autism spectrum or Aspergers or anything. Is it Aspergers or Aspergers? Not sure. I think it's Aspergers. I have been saying Aspergers, but I think it's Aspergers. Anyway, my problems are not on that scale. But they did say something to me that really shocked me, and they both came to the conclusion separately that I was actually very good at communicating with people. Which, for those of you who've seen my other mental health videos, you'll know is I just sat there kind of dumbfounded, because I've never found it easy to communicate. But they both said, and I didn't realise this, but whilst I was talking to the 2 of them, they were watching for tiny minute signs. Like, they were looking at how much eye contact I make with people when I talk. They were looking at my hands, they were looking at my body language, they were looking at, do I have any facial movements when I talk to people? And all of these things are signs of struggling to relate to another person, which of course I didn't realise. They are experts. They know how to sit in front of a human being and to look into my eyes or look at my face or my hands and understand that certain things I do either suggest a problem communicating or not a problem. And they said that my eye-to-eye contact was pretty much constant. I don't sort of look at the floor when I was talking to them. I'm not looking at the table. And they said that I was excellent at engaging both of them in conversation. When I was talking about my love of books, my love of history, ancient Rome, ancient Greece, my love of riding my bike, my veganism, my weight loss, they said that I communicated all of those things in a really clear, excellent, kind of positive way. And in fact, the lady doctor said something which really left me feeling shocked, and she said that she actually really enjoyed the communication between the 2 of us, and she really enjoyed the interaction. And for somebody who has autism, is somewhere on the autism spectrum, or has Aspergers, that often just doesn't exist. The enjoyment of back and forth between people just isn't there. So that was really shocking, because I've spent my whole life thinking that if I talk to somebody, they're not interested in anything I've got to say, and I don't really have much to offer somebody in terms of conversation. But apparently, and these people are experts, so I'm not going to suggest they're wrong, but apparently I'm very good at communicating with people. My eye contact is excellent. I don't shuffle around. I'm not uneasy. So that was great. But anyway, the main thing that I took from that is obviously that my problems are not on the autism spectrum. They're not Aspergers, which we kind of knew, but you know, it's great to have experts, it's great to have experts confirm that. So yeah, it was interesting. I went in there slightly concerned about maybe autism and Asperger's, and I came out having had 2 people tell me that they really enjoyed interacting with me and that I was very, very good at engaging people, which, as I said, is something that I would never in a million years have said. Now, did they say that to me to try and give me some confidence? Did they say that to me because it's not necessarily true, but they wanted to just sort of be nice and pleasant to me? That did cross my mind, but then I thought, you know, these people are professionals. I'm not sure that if I wasn't very good at communicating with people, and if I had problems like that, I'm not sure that professionals would think it responsible to tell me something that isn't necessarily true. So, I don't know, maybe all these years that I've struggled to communicate, maybe it's just my own opinion, my own lack of self-esteem, my telling myself. I mean, if you tell yourself from a very young age that you can't talk to people properly and that nobody's interested in what you've got to say, you know, that thought is going to manifest itself into your reality. And maybe I need to start thinking that actually I can communicate with people properly. I mean, I'm communicating with you now, but I'm looking into a tiny little dot on the top of my laptop, which is my webcam, and there's nobody else in the room, so I feel very safe and very secure in doing this. If you were in the room with me and I were talking face to face, I wouldn't feel so confident. But maybe that is just a self-confidence thing. I have very low self-esteem, as most of you will probably know. Although a lot of you have commented that I don't come across as having low self-esteem. Again, I think that's because you and I are communicating via a camera. It's easy to talk. When I first started making videos, I hated sitting in front of a camera. It was so hard. But then that again makes me think, you know, if I struggled to make videos because talking to a camera was incredibly difficult, the fact is that I've persevered in making these videos, and now I find it very easy to sit in front of a camera and talk. So my thinking is maybe that my difficulties in communicating in a one-on-one situation, maybe that's just because I've avoided doing it and I keep telling myself I can't. And maybe if I can reduce my anxiety and if I can deal with my dissociative disorder to a point where I can actually start to socialize, maybe the first half a dozen or dozen times that I socialize, I might find it hard to talk. But just like if I persevere making videos, I find it easier and easier, maybe I'll find it easier and easier to talk to people face to face, and maybe I can finally start to make some friends. So yeah, that was the situation. I was in 2 minds as whether or not this was an important appointment after my doctor at the hospital last month told me that I didn't have autism, Aspergers. So I wasn't sure whether or not this whole appointment on Wednesday was worth doing, but I'm really, really delighted that I went, because they confirmed that I don't have, you know, my problems are not on the autism spectrum, it's not Asperger's, which was wonderful. But they also made me they made me feel better about myself by just telling me that I'm very good at engaging with people, and I've always thought that I was hopeless at doing that. And they've given me a lot to think about. I've been thinking about it pretty much non-stop ever since. So that's an update. So I'll say goodbye to you. I'll say thank you for your continuing support, and I'll see you all again very, very soon.